James Southwell-Keely here, talking about tummy tuck or abdominoplasty. Now, there are many different reasons people seek out abdominoplasty operation. For instance, an excess or sagging of skin of the lower abdomen, the lower part of the tummy, or a separation of the muscles internally, which often happens either with age or with pregnancy, or combinations thereof. That excess fold of skin can cause rashes above the undergarments, irritation on the clothing, and it can be very difficult to find clothing that fits you, which can cause its own array of psychological problems. So there are many different reasons to pursue the surgery. Before surgery images of a patient having a tummy tuck show the redundant and excess lower abdominal skin and fatty tissue, as well as the widening of the hips. Now, truly the hips have not widened, but the apparent widening of the hips and the waist is due to that muscle separation. The post-operative image of the same patient shows that restored waistline, the removal of that excess redundant abdominal skin and fatty tissue. And whilst there is a scar that runs from one side of the hip to the other side of the hip, it's positioned nice and low so it can be concealed with most clothing. So in preparation for surgery, you want to be as well rested as possible, drink plenty of fluid, a healthy diet in the lead up. An important thing with tummy tuck is that if you're trying to lose weight, you've achieved your ideal weight and in turn you've maintained that weight for at least 3 months. Then you know that you'll be able to maintain that weight afterwards rather than having it come back on. If you are a smoker, it's not a surgery for you because of the potential problems that smoking can entail. And I'd say you'd want to be abstaining from that for at least 3 months pre-surgery. The surgery itself takes somewhere between 2 and 4 hours, depending on how much is involved, and will require an inpatient stay of around 5 days. The abdominal apron or the loose skin is lifted off the underlying muscle. The underlying muscle, which is separated, is then brought back together into the midline, restoring your core strength and stability. And then finally, that loose skin is allowed to hang back down and removed, the belly button being brought back to the surface. What you're left with is a large scar that runs from hip to hip, but in time that fades, and when well planned, will be hidden by all of your clothing. Having returned home from hospital, you take it easy for a week or so, and then just slowly start reintroducing your activities of daily living. In terms of exercise, I'd like you to abstain for 6 weeks, but by the 12th week, so between weeks 6 and 12, you can generally build up until by 12 weeks, you're flying. You're doing everything that you were doing pre-op. Now, in choosing your plastic surgeon, my advice would be to find a surgeon that's affiliated with the Australian Society of Plastic Surgeons, that's the ASPS, and of course, a surgeon is a fellow of the Royal Australasian College of Surgeons. Those initials after their name are FRACS. I operate out of St Vincent's Private Hospital and St Luke's Private Hospital, as well as St Vincent's Hospital. If you'd like to come and see me, please reach out to my practice manager and make an appointment.